All right. What is the most important thing to discuss with my doctor regarding bispecific treatment in lymphoma? What should my first question be? So, Dr. Phillips, if you had to advise this patient, what would be the one question they should ask their doctor or you if they were being recommended a bispecific?
Well, I think it depends on the disease, whether it's even an option, but I think the physician's experience and comfortability with managing the side effects. Again, we talk about CRS, we talk about ICANS, but again, ICANS is not necessarily much a big issue. And CRS, when properly managed and managed in an appropriate time frame, does not really escalate into a big problem and something that can be really managed conservatively. So your physician's experience with these treatments is probably most important as of right now, because again, I think all of us who've had experience with these drugs have become quite adept at managing the adverse events and preventing escalation of CRS to where our patients are going to need intensive care. And we can manage most of these on the general floor, even as an outpatient. So if your disease is appropriate, large cell lymphoma, follicular, I would say your physician's experience and whether they have, I mean, the facility should also have tocilizumab on hand just in case. But also that really also stems with the physician's experience, because if they are experienced with dealing with and managing the bispecifics, then it should be a very tolerable treatment. Again, you'll have maybe a few ups and downs for one treatment day during the step-up dosing. Thereafter, it should be very manageable. And if your physician isn't experienced, then whether there's somebody they can refer the patient to initially to get started and then thereafter. If follicular, again, it could be given before or after CAR T. If this is a large cell lymphoma patient, your first question should be, am I eligible for CAR T? And if you're not, then again, the discussion for bispecifics.
Yeah, and again, yeah, it's more like it's experience and like the infrastructure in place. Like I'm at a university, we just started giving these bispecifics outpatient, and we have a plan in place where they'll get a nurse call, what to do if they have a fever. We have all these protocols in place to manage these things, and it can be quite complex. So, I would ask, what do I do if I get a fever at home? What's the next step? Do I come, and make sure that they've thought through these things? And, well, it took us some time to figure this all out. We had committees, so it can be challenging, but these can be done really safely once the appropriate measures are in place.